Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Fairfax, Virginia, discussing self-healing and how it can help you overcome many chronic diseases such as cancer, fibromyalgia, chronic pain, Lyme disease, multiple sclerosis, and more with one of this area's top self-healing experts, Dr. Wes Rocki. Dr. Rocki was educated on 2 different continents and has received training at both the University of Connecticut and Vanderbilt universities and is widely recognized as one of this area's top self-healing experts. Welcome, Dr. Rocki.
Thank you very much, Rocco, for visiting with me. I appreciate your time very much.
Oh, it's our pleasure. We've got a lot to talk about regarding a very important topic, namely self-healing and all the many benefits that it can provide to so many folks that suffer from various chronic diseases out there. But before I begin by asking you to tell us about the various treatment options that we have available to us through self-healing, I understand you recently moved here from San Francisco.
Yeah, I just moved here 6 months ago, pursuing my big dream of coming to the area which I believe will be the center of the activity of forming new medicine. I believe that this is right place and right time to realize dream of forming a big center or network of small centers when we teach people to take care of themselves by practicing self-healing in addition to whatever they use from medicine. I believe that it's time for us as a society to take accountability for many aspects of our life, and the health is first of the most important.
Yes, it is. Health is the greatest wealth, as they say. And so the nature of your practice is to provide various self-healing techniques and treatments that you're going to get into momentarily, I'm sure, with medicine that may be already being taken by the various patients that suffer from various chronic diseases. So in other words, in conjunction, self-healing in conjunction with medicine, if need be.
Yeah, you are right on target summarizing my practice. First, it is that my practice complements and synergizes other modalities of treatment, mainly the Western, mainstream, highly technical medicine, but other modalities as well. And the second is that my assistance to clients is more of the partnership. When I inspire them, I coach them to reconnect with their own inner wisdom and their own self-healing capacity. This way, they are empowered to partner more proactively with whatever therapeutic modalities they use, or if they prefer, for example, clients who are interested mainly in the health maintenance. They may not have primary problems with the diseases, and then my assistance will be of the primary modality. So I'm going back to the roots of word doctor, which is doctore, which means to teach. I am teaching, coaching, encouraging people to discover their own potential of self-healing.
Very interesting, and it's within all of us, from what I understand, and it's self-healing experts like yourself who know how to tap that within our soul, within our being, if I may use that word, and really bring that out and help overcome the various ailments, diseases that we may suffer, whether it be in conjunction with medicine or not, depending on the problems that we suffer from.
You see, Rocco, the self-healing is the basic attribute of our body. When you cut yourself, on your skin and it's bleeding, and then a week later, there's not even trace.
That's right.
And you didn't do anything for that. So there is something in us, the inner wisdom, inner intelligence, which takes care of our healing. And this brings me to the fundamental understanding which excites me as I am practicing, that every healing is actually self-healing. Even the experiencing surgical procedure, the outcome would be different, depends on the attitude to self-healing, depends on the faith, belief of patients who recovers from surgery.
Yeah.
Besides self-healing, our body has another very important feature which is used in my practice, is communication. We call this biofeedback, which practically means that body talks to us all the time.
Interesting.
It talks to us with the quality of our thoughts, emotions, with our hinge, when we have intuition, when we feel something to happen. And interestingly enough, body talks to us with symptoms, talks to us with pain, with fever, with discomfort.
It lets us know when there's something wrong. We start feeling it, realizing it in many cases.
Yeah, and always talks with us as a friend, as somebody whose primary objective is to support our life.
Now, who would benefit the most from your practice as far as the folks that are out there watching, Dr. Rocki?
There are several categories of clients who may benefit, starting from those who face chronic conditions. These people, as the condition progresses in time, tend to lose the identity of their unique personalities on the account of acquiring identity of the diseases. So, for example, after a couple of years of experiencing diabetes, Mr. Brown becomes less of Mr. Brown and more of Mr. Diabetes.
Yeah, that's a great point.
His life decision, life choices are surrounding the identity of the disease. So in order to go back to health, we have to re-educate the mind of patient to remember the feeling, the energy of health. So every chronic disease has component of so-called psychosomatic component. It means that as we experience chronic diseases for a long time, we cannot differentiate the component of the physical attributes of the disease and the mental and emotional attributes. They are all combined. The mainstream medicine is very effective attending to the physical aspects of the condition. However, there is unmet need to attend to the emotional and intellectual, mental, spiritual aspect of experiencing chronic diseases. And this is what I do in my practice.
Now, what would you say are the most important aspects of health and disease, Dr. Rocki?
The most important aspect to understand is that this is just continuum. That we have the same capacities of handle both. We have the same resources of handling both. Also, it's very important to understand, and actually this was officially proclaimed by WHO definition of health, that health is not just absence of the disease. Health means full desired functioning in many aspects of life. Mental, emotional, social, family, spiritual. All this defines health.
So it includes all of that, as opposed to what a lot of us sometimes accidentally or erroneously, I should say, after what you just told us, look at it as maybe just, oh, my leg's hurting or my elbow's hurting or I'm emotionally not there today, as opposed to everything is what's involved within the health.
Yeah, you're hurting elbows may actually be spoke organ for your deep dissatisfaction with your job, which is not rewarding.
You help for all of us to better see things more clearly without the blinders on.
Yeah, this was a story of a lady coming to ENT specialist, and he's looking at her ear while she talks about her life, her impending divorce, whatever. And the ENT specialist saying, "Lady, I am only interested in your ear. I am ENT specialist." And she says, "Doc, but I came with my ear."
That's right. That's a great point. Yes, indeed. A great example you just gave us, Dr. Rocki, to help really see things very clearly and how everything is related. Now, can you tell us all what exactly is self-healing? I mean, you've touched on it, but can you maybe elaborate a bit so we really understand what we're talking about?
You see, body has natural tendency to keep balance. Regardless of circumstances, there is natural pull to come back to the balance of health. Self-healing utilizes this basic characteristic of the body of bringing back to balance. Also, self-healing relates to the fact that even in the middle of very difficult disease, somewhere in our body, energetically, there is encoded memory of full health. For example, as we have this conversation, I may ask you to remember something from your very early childhood. And you have no difficulties to bring the memory together with taste, with all vivid image of it. Because it didn't go away. It stays in your energetic memory of your body.
Yes.
The same of the feeling, memory of the full health. It is still somewhere there in your body. We call this subconscious mind. And I'll explain this later. But that memory of perfect health can be accessed with the tools I'm using in my practice, mainly medical hypnotherapy. And once the connection is made with the memory of perfect health, we can bring this to forefront as a very important therapeutic tool to deal with the disease.
So how exactly does it work? How does someone like yourself, a self-healing expert, really help us tap in to what's within us, to really utilize our entire being when it comes to fighting diseases and things along those lines?
My capacity to invite you to explore your healing as a patient starts actually with my own personal story of experiencing my own self-healing. I've been in medical practice for almost 35 years, being a gynecologist, then internist, then the teacher in medical school, and then I dedicated 20 years of my career to clinical research for pharmaceutical industry. Part of that was obviously fascination with the human body, how it works. But part of that was also my personal pursuit of my own healing. I was, as I understand now, gifted with a condition which is not deadly, but can impair quality of life, which is called overactive bladder.
Okay.
Which practically means that one with this condition has to urinate more often than desired, which obviously complicates the life.
Yes.
And that put me on the path of discovery how to heal that. Many of physicians who evolve from one part of medicine to the other are actually motivated by their own challenge of chronic diseases.
Yeah.
So this was my path, and even kind of interestingly enough, in one of the pharmaceutical companies, I spent 5 years investigating exactly therapeutic approaches to my condition.
Oh my God!
Yet, I couldn't find answers within the framework of the Newtonian medicine, which sees our body as a physical and biochemical event. I could not find the answer. So I had to step on the other side when we see medicine more from the quantum physics.
Yes.
And I took it very seriously. I dedicated 3 years of my time, full-time studying more than 25 different modalities of alternative medicine.
Very interesting indeed, Dr. Rocki. And the types of chronic problems and diseases that self-healing can certainly work towards correcting, eliminating, or certainly minimizing. We mentioned some of those at the top of this program. We're looking at cancer. We're looking at multiple sclerosis. We're looking at fibromyalgia, Lyme disease, and I'm sure certainly more.
These all conditions are characterized by major challenge to life. Actually, it starts with the diagnosis of one of these serious conditions when my help is very essential. Let me explain how it works.
Okay.
For example, one is given a very serious diagnosis of, for example, cancer or MS or some other like disease. That diagnosis at first is like trying to read this paper from this distance.
Yeah, right up on your face, basically.
It's overwhelming.
Yes.
You cannot see anything just by the diagnosis of cancer.
Yes.
Then my help is to facilitate this movement of distancing oneself to this situation when I can read this paper.
I got you.
This paper is such a distance that it provides useful information for me.
Yes.
The same is with diagnosis. The diagnosis is to provide us with the useful, vital information,
Yes.
so we can make important life decisions according to the diagnosis. But most of the time, since we are not equipped with this kind of cold-headed facility to distance ourselves from bad news, we become very overwhelmed, paralyzed, and completely dependent of the outside intervention.
Now, what types of results can we expect from the self-healing techniques? I'm sure they vary patient to patient, and there's a lot of factors involved, but in general form, what can you tell us about the results?
Well, the results can be divided both on the symptomatic relief and what I believe is changing in natural history of the condition, like any form of cancer pain, lower back pain, abdominal pain, also for conditions which have accentuated symptoms. So there is a symptomatic relief. The other aspect is that we are actually changing the inner setup of patients in terms of the beliefs, attitudes, hopes, spiritual beliefs and practice, which not only changes the disease, but changes the person.
Yes.
So the person who is changed is handling condition in a very different way.
And how long can these results last once they are achieved? Is it something that as long as you're in that right mind frame and totally utilizing all and tapping into all the resources we have within ourselves, as long as we stay on that mode, the results will, I take it, stay in a positive direction, or is it temporary?
Yeah, this is very important what you just stated, that the most important factor which determines the outcome is the commitment to practicing what is being learned as a part of self-healing.
Yes.
This is not one-time deal. This is changing of lifestyle, life attitude, which has to be sustained, practiced with very significant discipline. And discipline is nothing bad. It comes from the word disciple, which means just to follow.
Yes, that's right.
And then once this is done, the outcome can be permanent.
Well, this has certainly been a very informative interview, Dr. Rocki, and I wanted to ask you, before I let you go, you and your practice here in Fairfax, Virginia, have certainly established a reputation for excellence. Even though you moved here recently, you're renowned within your field. And I wanted to ask you if you can please tell us what separates you and your practice apart from many of the others. In other words, what makes you unique?
The first uniqueness is combination of three major modalities, which is medical hypnotherapy, energy medicine, and intuition medicine combined in one set of practice. It means that besides my medical degree, I have master's degree in intuition medicine. You may hear probably about people who call themselves medical intuitive. Those are capable to read diagnosis based on energy fields. I use my medical intuition to teach clients how to connect themselves with their own intuition. For me, it's much more important the wisdom you derive for yourself than me labeling you with something. Most of clients I see in this office come with many labels already.
Yes.
And I am helping them to arrive to their own label, which is usually that of perfect health, of identity with being complete person experiencing symptoms of some condition in life.
Yes, indeed.
Besides medical intuition, I offer hands-on energy medicine techniques, and probably you're familiar with some of them, like Reiki, quantum touch, craniosacral. These techniques support proper distribution of the energy within the body. One of the modalities would be acupressure, which is just similar to acupuncture, except we don't use needles.
Okay.
And medical hypnotherapy is really an essential tool to assist clients in discovering their subconscious mind, their beliefs, their attitudes. So this is probably the most important uniqueness, that I combine these three esoteric modalities in one setup of practice of a licensed medical doctor.
Yes, indeed. You combine the best of all into one practice to benefit folks in the total sense, within and inside and outside.
Correct, and that practice is done within the established standards of a licensed medical practice. That is very important.
Yes, it is.
The second uniqueness is that besides my medical degree, I have PhD in physiology. Physiology is the science of normal function. And that is very crucial in holistic medicine, because the traditional high-tech medicine is basically focused on pathology, on the disease.
Yes, yes.
There is very little dedicated in the training and then in practice of dealing with health. And you know, it's almost impossible to understand the disease without understanding health. It's almost impossible to guide somebody back to health without being just very knowledgeable what is health about.
That's right.
My PhD in physiology, in knowledge of normal health, is instrumental in completing the picture in my practice. Also, my practice is very unique in the format. I call this gift of self-healing. GIFT stands for guided, intensive, fast treatment. This is how my practice works. It's not for everyone. It's only for very committed people who recognize that healing as number one priority in their life. But for those, it goes very fast. To their surprise, goes very fast because the work is actually between the visits, not in the visits.
Oh.
When they meet with me, every session goes for an hour and a half. And the end of the session, patient leaves with homework and has to make a follow-up call to me within 48 hours, reporting on the progress of the homework.
Okay.
So there is significant commitment of patient side, and our interaction is more of the partnership when we are both vested to the same extent in the goal of the healing as well in the intensity of the self-healing process.
Very interesting. So you're basically providing the tools through the sessions and helping them and guiding them to really realize that it's within oneself, the power that we have that's been dormant or never really brought out in any shape or form, to really come out and work in conjunction together as a team in fighting the chronic diseases and ailments that many of us have, unfortunately.
Yeah, my job is to have clients realize that they have all the tools.
Yes.
My job is to make myself obsolete as fast as possible. I don't have clients longer in my care than maybe 3-4 months maximum. Another uniqueness of what I can offer is that I have been fully present of both sides of the fence of medicine. Just to realize there is no fence, obviously.
Yes.
But I've been practicing Western medicine. One of them was surgical specialty of gynecologist, then internist. I dedicated most of my career to research, and part of that was in pharmaceutical industry. And then I moved with a solid training to holistic alternative medicine.
Yes.
So I can understand all players in this process.
You've been on both sides, like you said.
Correct.
The traditional forms of medicine, through being an internist and gynecologist, not to mention on the wellness, holistic, self-healing side as well. So that gives you an advantage by being versed in the totality of various healing modalities that are available to us to really see what best fits each particular patient.
As they say, if you have only hammer, everything is nail for you.
That's right.
Also, I provide a uniqueness in recognizing that my work with patients is of equal partnership. When people join their resources to explore healing. And actually, this is probably the deepest secret of holistic medicine, that we practitioners benefit almost to the same extent from the session as patients do.
Very interesting. A little secret.
A little secret. Actually, I can tell how effective my session was by how much I heal myself. I feel healed by the session.
Very interesting indeed, Dr. Rocki.
So it's very rewarding,
yes.
And I know that it's very effective then.
I understand you're writing a book as well?
Yeah, the book is actually an extension of my practice, because I am writing the book which title is You Are Your Doctor, a required manual for self-healing. So I was lucky enough to receive the contract from the #1 publishing house in self-help books, Hay House.
Oh, that's good for you.
That's right. I feel very fortunate.
And good for many of us who can benefit by reading the book.
Yes, exactly.
Once it's published.
Because my idea behind the book is to touch many more people whom otherwise I wouldn't be able to do in medical practice.
That's right.
Also, I hope that this book will be instrumental in bringing attention people that the basic healing environment is within their reach, within their own body, within their own families, work environment, in the communities. In that sense, the mainstream medicine is only an addition, a partner in that healing, rather than exclusive provider.
Oh, well, that's certainly very good to know, Doctor. And on that note, it was a very interesting and informative interview, and I want to thank you for joining us and being a guest on our program.
Thank you so much.
It was our pleasure.